This is a pretty major point, malnutrition. This is one that I really want to strongly emphasize, and if there's one thing you take away or remember from this initial portion of the talk, the role of nutrition portion, it's going to be this. Um, Dr. Phil, again, in our clinical nutrition class, really emphasized this, and especially from the vantage point or the looking at the role of a naturopath in complementary care for cancer. This is something that is often overlooked with traditional treatments, and a lot of are doing a lot to help to educate on this front. Um, so what initially happened was studies were done on rats, on mice, to examine the effects of starvation. And lo and behold, they found that when they starved these animals, the rate of tumor growth slowed as well. Maybe this is a good treatment strategy. However, let's think about our garden. If we're starving the weed, we're changing the soil and we're starving the whole garden, right? So this is the issue here. So although it was doing a great, a seemingly great thing in slowing the progression of the tumor, the issue is that the host is suffering as well, and they are becoming severely compromised in their ability to maintain vitality, to not get infections, to combat the side effects of treatment. So eventually, researchers and doctors recognized that malnutrition significantly contributes to cancer-related mortality, and that many cancer patients have poor nutritional status and weight loss at the time of diagnosis. So, although you will still see some people who support the starvation protocols, I think the majority of oncologists and people who are working in the realm of cancer care are becoming aware of the value of avoiding malnutrition because of the fact that it relates so highly to increased mortality. So there was a study done here, in an older one in 1980, in the American Journal of Medicine. This particular study looked at over 3,000 patients with various cancers and followed their course of treatment. It found, two particular points were raised, and the first one was fairly intuitive, that cancer type plays a very significant role in determining mortality. We're pretty aware that there are certain types of cancer that are much more aggressive, have a much higher chance of mortality related to the disease, and we know that there are some that are milder. So that first point that they raised wasn't groundbreaking, but the second one was quite interesting. Within a particular category of cancer type, patients who maintained weight, the onset of treatment had significantly lower rates of mortality compared to those who lost weight. So this is really reinforcing the point that we need to avoid malnutrition, and in a moment I'll explain why that's actually as important as I'm making it to be. And on top of that, cancer patients that did undergo or saw weight loss, they had decreased scores of on their quality of life assessments. So take-home message here is we're actually trying to avoid malnutrition in this state, and I'll explain why. There's a concept, or not a concept, there's a term, cachexia. Now, this differs from starvation in that it stimulates basal metabolic rate. Basal metabolic rate, BMR, is the amount of energy your body needs to use in order to keep you alive. It's your basal, it's your most basic needs. For your most needs to be met, this is the amount of energy that needs to be burned. Now, if I go, a few hours, a few days, a week or so without eating, my body recognizes that, hey, I'm not getting food right now. Let's slow things down so that we can conserve. That's a defense mechanism, and that's typically what we see with starvation. Cachexia, on the other hand, is characterized by weight loss, anorexia, which refers specifically to lack of appetite, or loss of appetite, increased basal metabolic rate and immunosuppression, as well as muscle wasting. And the muscle wasting occurs specifically because of the fact that, despite the fact that cancer patients are typically not getting as much energy in, the amount of energy they're burning is increased. And so we're at a net loss here, and we start to see muscle wasting. And this is the keystone, this is the big point to take away, and this is the issue with malnutrition. Because if the individual is not able to match the amount of energy that's being burned off as a result of the cachexia, they will continue to see wasting. Now, this is a further challenge is presented in that tumor cells and the immune system actually suppress the appetite. As a result of the condition as well as treatment, there can be altered taste perception, and that's often overlooked and often a big contributor to the lack of taking in food. There's definitely fatigue if the tumor is in the GI tract, the digestive tract itself. Treatment side effects of nausea, etc. And being diagnosed with this condition can start a whole slew of mental disturbances, anxiety, depression, etc. So not only is a cancer patient entering a state where their engine is burning at a higher rate, their appetite is suppressed, and as you can see with the other factors, there's so many things playing into them not have a drive to eat and offset the effects of the cachexia. So this is a very critical point, and one that I really can't stress enough. It is very important with respect to how important nutrition is in the prevention and, in this case, the management of the condition. Coming to the end of this first section, this is just a side note, but I thought it was interesting. Dr. Phil presented this paper to us demonstrating that fish oil, when it says 3 grams EPA DHA, that's referring to a fish oil at a volume of, or a dose of 3 grams, versus placebo or versus Megastrol, which is a pharmaceutical appetite stimulant. 420 patients with cancer-associated muscle wasting were examined. They were randomized into one of these 3 groups, and the results demonstrated that fish oil had a greater effect than Megastrol with risk to appetite stimulating, and both of them were better than the placebo. With respect to weight gain, excuse me. So I thought this was really interesting. Fish oil has a whole ton of benefits. It doesn't have the side effects that you would see with a pharmaceutical aid, and if this is something you're interested in, definitely pick up the paper, or you can shoot me a question, but I definitely recommend, above all, seek the care of a naturopath, and they can fill you in and make sure that fish oil, if you are interested in it, is the right thing for you. This was a very, very interesting study, and just going along the lines of appetite stimulation and weight gain, that's worth looking into. So before switching to ingredients, how do we maximize our calorie intake? And these 4 points were taken from the Cancer Fighting Kitchen by Rebecca Katz. First, having smaller, more frequent meals. And what she stresses in the book is, it can be tough. It can be tough to sit down and even have a small meal. That can be a little overwhelming, especially if you're feeling extra nauseous and fatigued. But trying to get even a bite of food every 15-20 minutes will do you good. So again, this is for those individuals that are undergoing treatment, really trying to get that little bit of food into the system every 15-20 minutes will make a huge difference, and at very minimum that should be the goal. Second point, this was really cool, or rather really important, having prepared foods, when there is a spike in appetite, definitely worth having something on hand, so that during that small window of time you can get something into your system. And definitely pack your bag, pack your cooler, take some things with you if you do have a hospital stay. And if your hospital doesn't allow you to foods, I would strongly suggest looking elsewhere, because that's a bit scary if you're forced to eat their foods and you can't have, as you'll see in a minute with some of the ingredients, some of the benefits that you can gain from having your own prepared foods. The third one, this one was more cool, and something that I definitely overlooked until I read it myself, but treating yourself with visually appealing cutlery and crockery to really help stimulate the appetite. And when you think about it, if you have a nice placemat and a nice plate and everything's laid out well, appetite is much more than just the physical hunger. Food appeals to all of our senses, and having your food laid out in this manner can help to boost appetite as well as treat yourself. It's very much a chance to give back and to nurture yourself in whatever way you can, and this speaks to that. I thought that was really cool, and this couldn't have been more demonstrated than at the Cancer Society's Relay for Life event last night, getting everyone on board. Seeing the support, the family, the everybody sharing the effort was so amazing to see last night. And that definitely plays into how to maximize calorie intake on a daily basis. If the family's all together eating anti-cancer type foods, making an effort to prepare the foods, everyone's taking a keen interest in making this family effort, that will go a long way. And that's definitely something that's very important. So that wraps up the initial component, the role of nutrition, and why I'm even motivated to speak about this. As you can see, if we can work to bring down and control body fat percentage, if we can to offset malnutrition, a lot of good can come from it. So what we'll do now is we'll switch gears into the ingredients and look at, when we're working towards these goals that we've looked at, what kind of foods are we actually going to benefit from the most. So one of the most common questions I get now, and I've been getting for some time, is what's the deal with organics? Should I be going for it? They're expensive. What's the regulations? Um, from what I understand, Quebec is the only province that actually has like a government regulation on organics, where in Ontario and other provinces you have different organic certifying bodies. Now, that doesn't necessarily mean that the organics are not of high quality, of high standard, or of true standard, but it's just important to know. And that's, if it's something you're interested in, I definitely suggest doing some more research in that area to find out what's the deal with Ontario organics. The difference with organics is not going to be in the macronutrient um, um, arena. It's not going to have to do with the amount of protein or carbs or fats that you're getting, but the difference will be in the phytochemicals. Um, Phytochemicals are chemicals that are found within plants that we derive benefit from. And if you can imagine a plant that's being grown in the wild, that's not being sprayed with pesticides and has to combat the weeds and pests and combat the sun, it's going to develop a lot of defense mechanisms. It has to fight, and you're able to benefit from that by eating these particular plants, because again, they have developed a higher level of these phytochemicals. Um, it's not cheap to buy organic, so you can maybe look at what are some of the fruits or veggies that you eat more often, and instead of you know looking at what we know are the best organic foods, it might be worthwhile just looking at, okay, well, I buy a lot of apples, and although they say, just for an example sake, apples aren't the great to buy organic. If you buy organic, you've got to buy organic potatoes because you're getting the biggest gain. But if you're eating apples, then that's what's worth buying. So that's something I'd look into. There is a difference. And I'll definitely suggest, we're getting into summer, the farmers markets are going to be out, so as much as you can, take advantage of that, buy Ontario fresh, um, and because in some other countries we have no clue what their standards are for pesticide use and for agricultural practice. So at least, let's support our farmers, and as much as possible, you can definitely look towards organics. The difference is in the phytochemicals.